My name is Lisnet Dzidekha. I am a nurse. I am working at National Cancer Center Hospital in Lilongwe under Kamuzu Central Hospital. I was nominated by the First Lady of Malawi, Madam Monica Chakwera, to come here for my training. The challenges that we face in Malawi regarding the oncology management of our cancer patients, one of them is that we have a limited capacity of human resource, which is the number of the oncologists. We only have 5 as of now, 5 oncology doctors that are taking care of the patients in Malawi. We also have the lack of resources, such as the diagnostic procedures, measures like the MRI, like the CT scan. They're there, but they're just a few of them. We also lack resources such as for the treatment modalities, such as the radiotherapy, which is involved in the treatment of the cancer patients. This method is involved by killing the cancer cells of the patient through the use of high energy X-rays to irradiate the cancers. The other problem is that most people in Malawi, they first go to the traditional healers when they're diagnosed with cancer, not going first to the hospital, which also brings a burden. When they're coming to the hospital, they are already at the last stage of the cancer, and for us to manage them properly, it's very challenging. The 2 things which needs to be improved in our country regarding the oncology care are, one of them we can say the recruitment of the oncologists that we have. As I've already said, that we have a few number of oncologists that are there to manage the whole population of Malawi in regarding to cancer care. So this number of people, if they can be improved, if more people can be educated on cancer management, it can be a better way to manage these cancer patients. This program for Merck Foundation is very important to me because I have learned a lot of things. The knowledge that I've gained here and the skills that I've also gained here, it is something that I was also practicing before, but I have added an extra knowledge in the management of care of my patients when I go back to Malawi. And for the patients, these patients will benefit a lot with the knowledge that I have in taking care of them. We know that the patients, in the treatment of care for the patient, it involves the 4 aspects of care, which involves the psychological management, spiritual management, social management, as well as physical management. So as my patient will be managed holistically. And to the Malawi as a nation, most patients will benefit from this program because of the skills that I will give to the patients out there. My expectations for this program were, before I was coming here, I had the knowledge that cancer is managed through, one of the treatment modalities is through the radiotherapy, which we don't have currently in Malawi. So my expectation was to come here and learn more on this method and how, as a nurse, I can be involved in this management of care, as well as to gain all the skills and the clinical practice in the management of the patients. All of my expectations that I had when I was coming here has been fulfilled during this program. In terms of my theory, as well as my clinical practice, I was taking care of the patients. During my training here, I've been exposed to so many areas. For example, I've been exposed to the outpatient department, which is involved in the diagnostic procedures for the patients, where the patients are diagnosed. For example, those with breast cancer, there is the mammography where they're conducted. There are also some screening procedures that are taken care, like for the cervical screening and breast cancer screening. I've also been exposed to the radiology department, where I have seen some machines, the magnetic resonance machines, the computed tomography machines, which is the CT scan, as well as the sonography. I've also been exposed to the wards where the patients, after they have been admitted, they're there to be taken care of from the nurses. I have been there to different wards, the surgical wards, the medical wards, the chemotherapy wards. This training will be helping me and my country in so many ways. For example, the knowledge that I have will be transferred to my patients in taking care of them. And the other reason is that the country will also benefit because it has improved in the number of trainees that have been trained on the oncology, especially oncology courses, and this will help to improve the care. As I've already said, that there's a burden of the healthcare workers back there. So with the knowledge that I have, the patient care will be improved. My advice to the new aspirants for this course is that they should take this course seriously, because it is a good course which will benefit them as the healthcare workers in terms of the knowledge and the skills, as well as the patients. Like their skills will be improved to take care of the patients, and the nation will also benefit because they will have a number of people who has been exposed and trained to the management of oncology care. When I go back to Malawi, my plans are to continue working in the same department, to continue providing the care that I have also been provided before, but in a well-experienced way. I will also transfer the knowledge that I have to my colleagues who haven't had the chance to come here for the training. Firstly, I would like to thank Merck Foundation for giving me this opportunity to come here for the training. I really appreciate for that. I also want to thank the First Lady of Malawi for recommending me to come for this training, and also the institution here at Krishna Vidyapeth for giving me the opportunity to come and study. Malawi.